Joining us now is Christina Clark Okarmus, the Executive Director for the Alabama Campaign for Adolescent Sexual Health. Christina, thank you for joining us.
Thanks for having me.
And a big APT welcome. This is your first time joining us here in studio. We love having first timers. Our previous guests were first timers, so we're 2 for 2 tonight so
awesome.
far. I know that you have been really involved in the trenches, on the ground, with this adolescent sexual health work for years.
Yes.
Tell us about that.
Yeah, so I started this work in 2011, fresh out of grad school, and you knew our predecessor, or my predecessor, Jamie Keith. So she hired me straight out of grad school, and I just have been here ever since. I think in 2019 is when I became executive director. Jamie retired, and I just have a real passion for young people receiving the information that they need about their bodies and how they work and how to make them healthy. And I didn't receive sexual health education, or at least not anything to brag about in my time at school. And so I think it's just a really important thing for young people.
I think I have the same story. I don't remember any real lessons in school. My mother was very open with me in talking about it, so I got my education from her.
Good.
And I'm really glad that I did. And I know that's a huge part of what you all do is educating parents, students, kids, community
Yes.
partners, all of that above. So when I hear adolescent sexual health,
Yes.
that's a pretty broad term. What are we talking about here?
Yeah, so, for us, sex ed, we really are looking to advance comprehensive sex ed. And so sex ed, by that we mean everything that really would touch on things related to relationships, healthy relationships, bodily autonomy, consent, of course, the ins and outs of how just things work, that anatomy and reproductive anatomy and physiology is so important. Menstruation, puberty, it really runs the gamut, quite frankly. Sexual assault prevention, those sorts of things. And we are very focused on getting the message out to young people through the adults in their lives. So you know this, that we have done lots of trainings over the years, probably hundreds of trainings over the years of what we call youth serving professionals. So those folks that work with young people in some capacity. They're educators, they're school nurses, they are sometimes coaches, they are school counselors. They're interacting somewhere with young people in their lives.
Even community partners like Boys and Girls
Absolutely,
Clubs. Yeah.
yes. I failed to mention that, but absolutely. We've worked with Boys and Girls Club before. And so, yes, we are looking to reach those adults who that can reach their young people with this information. And parents are such a critical part of passing on this information. We want to empower parents to have these conversations with their young people, to feel confident and comfortable having these conversations. So a lot of times parents don't feel that way. Even for me who works in sexual health, being a mom, it's kind of daunting to think about having those conversations. But I know that there are tools that are out there, that there are folks that can guide me in the right direction.